Hello, it's Dr. Rhonda Johnson. Today is Monday, May 3rd, 2021. And today I'm going to be talking about how the coronavirus is here to stay. You know, we are now into the 14th month since the World Health Organization declared that this SARS-CoV-2 virus had caused a global pandemic. And the experts now say the virus is here to stay. Now, for some of us, that's just an awful thought. But since this virus is now part of our human experience, I thought I would do a review. So here we go. Now, remember, this virus, we can't see it. It's roughly 1/900th the width of a human hair. It's codependent. It's tiny. It requires a human or another cell for its existence. It attaches to our cells through the spike protein. Once it's in the cells, it takes over, hijacks the cell, replicates, meaning it makes more of itself, and then it wants to move on to its next host. That's you or me. And that's the life cycle of the SARS-CoV-2 virus. Now, when it's naked, it means a virus by itself. It can't go anywhere. It can't do any harm. It has to hitch a ride with a droplet of mucus or saliva to survive. Now, where does it get the mucus or saliva from? From us, through the nose or the mouth when we cough, sneeze, laugh, sing, breathe, and talk. In order to get access to our cells, it has to get inside our body, and it must enter our body through the eyes, the nose, or the mouth. Now, we know through these variants that the virus is changing, and it's changing quickly. And these new variants are spreading very easily. And people, the natural hosts for this virus, are really cooperating with this invisible killing machine. So what does the future look like? We're 14 months into this. Well, of course, no one really knows, but we know what we know today. And so let's take a look at different parts of the world to get a sense of what the future might look like. So let's start with India. Less than 2% of people in India have been vaccinated fully, and the virus is infecting more than 400,000 new people every day. Hospitals in India are at a crisis. People are dying by suffocation from this virus because, you know, it destroys the lung tissue and people suffocate to death. And they're dying in the streets of India. And India has its own new variants, which is probably creating some of the disaster in India because they're spreading fast. The virus is still suffocating lots of people throughout the world, in Brazil, in the US, in Europe, and now Canada. We must always remember that this virus is not just a simple cold virus, folks, that it doesn't just infect the lungs. It also infects the brain, the heart, the nervous system, the blood system, the kidneys, the gastrointestinal system, and the skin. Now, let's look at South Africa. Less than 1% of South Africans have been vaccinated. And the South African coronavirus variant is resistant to some vaccines, and it has the ability to escape antibodies that are formed against it. Look to the north, to our border of Canada. Canada's vaccine rollout has been very slow. In fact, a lot of Canadians are coming here to the United States to get vaccinated. And some people are waiting 4 months between doses. Just 3% of Canadians are fully vaccinated. And Canada is in the midst of another COVID surge. So let's take a look at the U.S. Now, we have excess vaccine supplies, and more than 246 million Americans have had shots in their arm. But that represents 40% of all U.S. adults, which means that 60% of adults have yet to be vaccinated. And we face challenges with our vaccination efforts. Some populations, like homeless populations, rural areas, migrant workers, and community of color, vaccine access is still unequal. And then we have vaccine hesitancy, where people have access to the vaccine and won't get it. So my message to folks is, remember, as I've talked about this virus, that your risk of getting COVID is a function of how close you get to somebody who has the infection, how long you're near that person who may be infected, your age, of course, and your health determine how sick you'll get if you get the virus. So, and of course, vaccination is a major tool in the prevention of this virus. Now, we know now that the vaccine is not necessarily 100% effective in all people, because certain people have weakened immune systems and the vaccine just does not produce enough immunity. But for now, I want you to remember that you still have prevention tools such as masking and physical distancing. And remember that 60% of American adults aren't vaccinated. So please err on the side of caution, wear your mask, continue to wash your hands, and continue social distancing. This is Dr. Rhonda Johnson. As always, my views are my own. Stay safe and have a blessed day.